When in the room, I'm going to wash my hands. I'm going to introduce myself. My name is Vina. I'm going to be your nurse. I'm going to do a newborn assessment. Then I'm going to put gloves on. I am going to identify the infant, so I'm going to ask for mom. Can you tell me the baby's name and date of birth? Going to make sure that the bracelets are correct, and they are. They are the same. They're verified. Then I'm going to remove the baby's clothes, and I'm going to oscillate the apical heart rate for a full minute. I'm going to listen to its lung sounds. And bowel sounds in 4 quadrants. The baby has normal heart sounds, no murmurs noted. There is no signs of respiratory distress, no nasal flaring, no retractions, and there is active bowel sounds in all 4 quadrants. Then I'm going to assess the baby's head. I'm going to palpate the sutures, and I'm going to check the anterior and posterior frontale, and it should be flat and soft. There's equal hair distribution. Its outer canvas of its eyes is equal to the pinna. The sclera is white, and its conjunctiva is pink. The nares are patent with no secretions. Its lips are pink and moist, and mucous membranes are moist. I'm going to assess its chest. There's no lesions or bruises or abrasions. Then I'm going to assess the umbilicus. Just for redness and bleeding, there is none of that. Its abdomen is non-tender and is not distended. Then I'm going to check the lower extremities, and I'm going to check the femoral pulse, the pedal pulse, and the brachial pulse, and those are strong and equal and bilateral. Then I'm going to assess the baby's back, and what I'm checking for is to make sure that the spine is aligned, if there's any sacral dimples or any abnormal hair growth, and the spine is aligned and there is no sacral dimples or abnormal hair. Then I'm going to remove my gloves, wash my hands, and put new gloves on and start my reflex assessment. So I will start with the rooting, and I will swap my finger from the ear along the cheek to the mouth. The baby turns his head towards my finger and tries to root. The sucking reflex, you put your clean gloved finger in the mouth and the baby should suck. Also, when I'm removing my hand, I will take my finger and swap across the top of the mouth. That's to make sure that the palate is fused, and it is fused on this patient. I will start with the palmar reflex. I will put my finger in the baby's hand, and its fingers will curl around my finger. The palmar is I'll just put my finger here, the toes will curl downward, so that is there. The Beninsky is I will take my finger and just swap around the toes, and they move outward, hyperextend like they're supposed to. And then I will do the Maros, which is where I just startle the baby, and its arms will flare out, and they should return mid-line. When I do this, I want to note that the baby does have a lusty cry. It does respond to the stimuli, and it moves all of its extremities well. Then I'm going to assess the diaper area on a female. On a female, you look for, you assess the labia to make sure that the majora is larger than the minora, and that just note that there is like no drainage, no skin breakdown. On a male, for circumcision, you would assess the site for bleeding, redness, And then you need to check the anus to make sure it is patent. And you just put it back on. There's no skin breakdown between like where the diaper is. So then I would remove my gloves, wash my hands, put new gloves on, redress my baby. This is a good time to talk to the mom and ask her about like how many wet diapers has the baby had, has they had their first bowel movement, and to make sure to teach the mom like babies should have between 6 to 8 wet and dirty diapers a day, and the first bowel movement is the meconium, and it's black and tarry, so that is not abnormal when you see it. Then ask the mom if she wants to keep the baby or take it back to the nursery.